If you're pregnant and you have sciatica, there's only so much you can do. What I mean is there are some uncontrollable factors related to pregnancy that can cause back and sciatica pain, but there are also some controllable factors you can change and exercises you can do to reduce your pregnancy-related back or sciatica pain. And in this episode, I'm gonna give you the 7 reasons why back and sciatica pain can be caused during pregnancy, and then 3 specific exercises you can do today to finally get some relief during this special time period. My name is Dr. Grant Elliott. We've helped thousands with low back pain, disc herniations, and sciatica fully recover through our one-on-one online coaching program. And in this episode, I'm going to teach you how to fix pregnancy-related pain. So first, what are the 7 reasons why back and sciatica pain is so prevalent during pregnancy? The first one is hormonal-related changes, and this is obviously an uncontrollable factor. The main hormone that changes during pregnancy that can relate to increased pain is the hormone called relaxin. Relaxin softens joints and ligaments to prepare for childbirth. This allows your pelvis to be able to expand to allow passage of the child, but it can also reduce the stability of the surrounding areas, such as your spine and surrounding joints. The second is as your baby grows, your center of gravity shifts forward, thus changing your posture during this time period. Now remember, there is no perfect posture. Everyone's gonna have different postures, and that's completely fine. It's not like one posture inherently is bad for everyone. But if you're in a posture that you are not acclimated to, that you are not used to, then this can cause pain. So if you've lived most of your life with a hunchback, actually it's not really a bad thing if you stay in that position because you're already adapted to it. And then if all of a sudden you were standing perfectly straight in military posture all day, you would feel pain, but also vice versa. So through pregnancy, as your center of gravity shifts forward the bigger you get, it pulls you into more of an anterior pelvic tilt type position, which is shifting the stress on the surrounding muscles and surrounding joints that your body is not used to. This is an uncontrollable factor, meaning your weight's gonna shift forward, but it is controllable in regards to our ability to utilize exercise to give these joints and tissues a break. Number 3 is weight gain during pregnancy. The uncontrollable factor of this is that there's obviously going to be a natural weight and a healthy weight that is gained from fluids and from the mass of the child itself. That will weigh something. However, additional weight put on outside of those things can compound and can increase stress on your body. We all know that additional weight on our spine, on our hips, on our joints, on our whole structure is not good for us. So if we're gaining excessive weight beyond what the child is actually weighing, then that could increase your likelihood for back pain or sciatica during pregnancy. The 4th is muscle imbalances and weaknesses. During pregnancy, the things that turn off, if you will, the most, they don't literally turn off, they just weaken due to not being used as much, is your core muscles. Of course, they're being stretched. The function of your entire core is completely changing as it's supposed to. That's an uncontrollable factor. And then due to the postural changes, you tend to use your glutes less during pregnancy as well. So this change in how your body is stabilizing and functioning can increase the risk of pain. However, the controllable factor of this is that we can do glute strength exercises during pregnancy to avoid losing strength in this particular area. The 5th factor is direct pressure on the sciatic nerve due to the uterus enlarging. Remember, there is a mass growing inside of your body, and it can impact things. You'll see many women holding their ribs and the kids kicking different places and hitting organs. Well, it can push below too, and it can hit the sciatic nerve or tissues around the sciatic nerve to increase pain. That's an uncontrollable factor. But number 6, changes in activity level is a controllable factor. It's definitely a tough time, especially in the later stages of pregnancy. My wife is on her 3rd right now, as you can see in the videos we've been using, that it's a stressful time and it can become difficult to be active in those later stages due to pain, due to exhaustion, and just the uncomfortableness that comes with being pregnant. So if the amount of our activity significantly reduces, then our overall physical fitness reduces, our conditioning reduces, our joint stiffness increases, our aches and pains increase, because we know movement is medicine. And if we're not using our body, if we're not getting fluids moving, if we're not using our muscles, then that's just gonna make us weaker and stiffer, and we have more pain. So trying to maintain as much activity as you're able to is the best goal. And especially going into pregnancy, being as fit as you possibly can be, as active as you possibly can be, going into pregnancy and maintaining that lifestyle, maintaining those activities as long as you're able is the main goal. And number 7 is changes to the pelvic floor and pelvic girdle specifically. Stressors on the pelvic girdle can affect the back and the hips. And then also all of the pressures that are going on the pelvic floor and maintaining pelvic floor strength and integrity can largely relate to these aspects too. Now, some components of this are uncontrollable, of course, but there are some controllable exercises that we can do to maintain pelvic floor health and strength throughout pregnancy that could help your situation. Now, I hope that those were helpful and that breakdown is something that you can analyze in yourself and see if you can improve on some of those areas. Now, here are 3 specific exercises that have helped a lot of our online pregnant clients around the world during this specific time period. The first exercise that can be quite helpful is holding a deep squat position. So ideally finding a pole or a squat rack, using it for support, sitting as deeply as you can, keeping your feet firmly planted on the ground with total contact. As we're sitting deep into the position, we want to breathe into our belly as much as we're able and down into our pelvic floor as to promote eccentric contractions of the pelvic floor. Getting eccentric contractions of the pelvic floor is one component of this position. The other component is sitting deep into the squat. You can let your lower back flex and round to take pressure off these joints that have been in an extended position majority of the day. Sit in this position as long as you can comfortably, breathing deeply, and using throughout the day. Now, the second exercise is to address the SI joint specifically because a lot of pregnant women struggle with this joint and it can refer and create sciatica as well. The way we do this is by improving strength and stability around the SI joint because, as you know, relaxin causes our ligaments and joints to become soft or looser. So we're going to stabilize this region to keep it tight and strong, so to speak. Get in a side plank position on the floor, knees bent, and we're going to pick our hips up and forward while we separate the knees at the top, squeezing that bottom glute and then slowly lowering. This is primarily working that bottom glute med, your lower back and core as a whole, and your bottom QL. This is going to help support these structures, keep them strong and keep them active throughout pregnancy. And you can certainly perform this on both sides. So even if you just have sciatica or back pain on one side, perform it on both sides to keep all of your structures as strong as we can. And this last one is going to relate to those who are dealing with some disc pressure or disc herniations during pregnancy that are related to their pain. For a lot of our online clients struggling with disc herniations, we find extension-based movements can be very helpful, such as those laying on the floor and performing a lumbar extension. However, of course, we can't be laying on the ground because we have a baby. So a way that you can perform this instead is in a standing position, grab a towel, pull a towel around your lower back. With your arms, pull the towel forward as to put you into more of an extended position. Lean back, hinging through the lower back, attempting to get as much extension as you can repetitively. Now you might be thinking, wait, earlier you talked about how you're going to be an anterior pelvic tilt and you already have extension. And isn't this more extension? Isn't that going to make it worse? Not necessarily, because any range of motion that's outside of the one that you've been stuck in can be relieving. So even if you've been more extended, if you go beyond that into further extension, it can still be a range of motion that your discs and your spine are not getting into. And improving your range of motion in multiple ways can be very helpful for low back pain. Extension specifically can help address many disc issues. So if you find significant relief with this one, it means we're probably dealing with some disc irritation, but this is a movement you can perform without putting pressure on your belly. Without assessing your situation specifically, these are some of our top recommendations for factors related to pregnancy as a whole. Some you can address, some you can't, and some exercises for our pregnant clients. Now, not everyone will respond well to these exercises because not everyone's situation is the exact same. So some of these might help, that's great. Some of these might not, that's fine too. What's most important though is that you're listening to me and you care about getting better. So this can give you an initial start, but if you would like a more specific approach towards your exact situation, then there is a way that you can get that so you don't feel like you're guessing what to do on the internet during such a special and unique time of your life. And one aspect is getting you out of pain now so you can just get through pregnancy and have the least complications during your labor as possible. But then also having a plan for after labor, a recovery plan to address your back, your strength, your pelvic floor, your sciatica, to ensure that after we can continue that process and have a bulletproofing process ready for you so you can get back to your old body and back to your fitness at the most efficient way possible. So if you would like to dive deeper with me and get a structured plan to healing specific to you, then all you need to do is text me the word pain to 317-751-9509, and you can get a tailored step-by-step plan to permanently fix your back or sciatica issues following our centralization process. Do it right now so you don't miss the opportunity to finally fix your pain and have the pregnancy you deserve and then the life you deserve after that so you can just enjoy your little one. And after you text me, please like the video, subscribe if you haven't already. Follow me on Instagram at RehabFix for more free daily videos and getting insight into my life and what I'm doing to keep my back bulletproof. Thank you so much for watching. I'll see you on the next one, and I'll see some of you in the program real soon.